Hey guys, Dr. Steve Oswald here, physical therapist with Idaho Spine and Sports Physical Therapy. Wanting to show you some simple tests you can do yourself to determine if your neck pain is coming from a pinched nerve. Now, our first test that we're going to do, it's our most important test because for most people with neck pain symptoms coming from spinal nerve being compressed, is our upper limb tension test. Okay. For this test, what you'll do is on the side that you're having your pain, you'll raise that arm up to your side. Okay, keep your shoulder down. Tilt your hand back like a waiter holding a tray, and then extend your arm out to your side. Okay. Now that should feel tight or may replicate your pain. Okay. Also, you can further sensitize it by bringing your head over to the side, and again, that will further increase those symptoms if it's positive. Okay. Our second test is what we call a Sperling's test. Okay. With this test, again, towards the side that you're having your symptoms, you'll side bend directly to that side, and with your opposite hand, compress straight down. What we're not doing is pushing further into side bend. We're not stretching, we're pushing straight down. And again, that will replicate your pain in your neck and may extend further down the shoulder into the arm. Our next test is what we call a distraction test. We're not distracting you physically, but distracting the joints in the neck. So what we'll do is with a comfortable hand position, whether you have your thumbs underneath your jaw or cradle in the back of the neck, you want to lift and attempt to separate the joints in your neck. Okay, that's the goal, so it's a lift. If that lift provides you with relief, that's a positive sign. Okay. Our last test is if you can't rotate your head towards that side. So again, if I have pain on my left side, if I turn my head and I'm not able to get the center of my chin past the center point of my collarbone, it's a positive sign. Okay. Now, all four of those tests together are important because they further raise the suspicion in totality that you have a spinal nerve that's involved with your symptoms. Now, if you have questions, please leave them below. Otherwise, thanks for listening.